Hello everybody, this is Dr. Vinod Pili, PGY2 Internal Medicine Residency Program, Sinai Grace Hospital, Detroit. Today I'm going to talk about our quality improvement project. The title of our quality improvement project is Low Adult Vaccination Rates in Resident Clinic. Is it missed perceptions or missed opportunities? The reason why we chose to take up this project was we all know that older adults and young children are at increased risk for infections due to their relatively weaker immune system. But these infections can be prevented with successful vaccination. However, in our primary care clinic, the vaccination rates among older adults were poor over the decades. So we plan to implement the CDC recommended strategies to improve vaccination rates. We all know that successful vaccination improves the overall clinical outcome and reduces the healthcare cost of vaccine preventable infections. Our main goal was to implement the CDC recommended strategies to improve vaccination rates, and our target was to improve the vaccination rates by at least 20% from the baseline by June 2021. For this, we used PDSA cycle and we tried to understand the perceptions and identify the barriers for successful vaccination among patients by distributing questionnaires randomly who attended the clinic. So we collected the pre-interventional data from February 2020. There were about 186 patients who were aged 50 and above who had the clinic appointment in February 2020. CDC recommended strategies or interventions were implemented, like provider reminders, vaccination education of providers and nursing staff, education of patients about benefits of vaccination through informative brochures and posters in exam room. And then we collected the post-intervention data from the 50 years and above age group patients who attended the clinic in February 2021. There were about 488 patients, and comparative analysis of pre-interventional and post-interventional data was done. The results of questionnaire was 34% of patients said they do not need any vaccines as they are healthy. 27% said that their provider did not remind them to get a vaccine. 27% were afraid of side effects. 20% did not know when to get a vaccine. 18% were not aware of complications of not being vaccinated. 15% thought vaccines do not work. 12% disliked needles. 7% there were some cost or insurance issues. We have a pretty good table in the center of this poster. This table is a comparative analysis of pre-interventional and post-interventional data. Overall vaccination rate was 4.8% pre-intervention, whereas 5.3% in post-intervention. There is a slight improvement, that is 0.5% improvement in overall vaccination rate. However, these results are pretty discouraging. Subgroup analysis showed 78% of those who were vaccinated received flu vaccine, and that was in the pre-intervention data. Post-interventionally, 54% received a flu vaccine, 44% received Tdap vaccine pre-intervention, whereas 27% received Tdap vaccine post-intervention. None of the patients received a pneumovax pre-intervention, whereas 27% of the patients received pneumovax post-intervention. Take-home point from this quality improvement project was These results are pretty discouraging, and we need better implementation of CDC recommended strategies. Every patient who comes to the clinic needs to be properly educated uh, about age appropriate vaccination and made aware of complications of not being vaccinated. It will be really challenging and a massive undertaking from the medical providers and as well as whole healthcare system to influence the patient's perceptions of accepting vaccination by highlighting the undeniable benefits of vaccines to their health and well-being of the society. These are my references, and thank you so much for giving me this wonderful opportunity. And I should also thank my entire team who worked on this quality improvement project. Thank you so much. Have a great day. Bye.